substitute teacher, I have worked with autistic children, and that made me want to learn more about autism. In 2009, the National Institute of Neurological Disorders and Stroke, a government website, stated experts estimate that 3 to 6 children out of every 1,000 will be born with some form of autistic disorder, also known as ASD, and that males are 4 times more likely to have ASD than females. So knowledge of autistic symptoms and the different forms are vital to accelerate placement and specific needs therapies. In this presentation, I will go over the forms of autism, 3 of the core symptoms, and some of the interventions used to help the children learn to function in daily life. Now, according to the Centers for Disease Control in 2009, a government website, the 3 common forms are as follows. Autistic disorder, known as classic autism. Now, people with this disorder usually have significant delays. Now, the second one, Asperger's syndrome, which is a much milder form of autism. And people with this disorder do not have language or learning disabilities. The third one is the pervasive developmental disorder, not otherwise specified, or PDD-NOS. Now, people who meet some but not all of the criteria for autism or Asperger's syndrome may be diagnosed with PDD-NOS. Symptoms might cause only social or communication delays. Now, according to the National Institute of Mental Health, a government site, in 2009, there are 2 rare forms of ASD. They are Rett syndrome, and it affects almost all females. Children will have a period of normal development before the regression period sets in for mental and social developmental regressions, and it's usually between 6 to 18 months of age before that'll happen. The second one is childhood disintegrative disorder, and this one is even more rare than the Rett syndrome, and it affects mostly males. Autistic symptoms may appear by age 2, but usually not until age 3 or 4. And the last one, which is Savant syndrome, and according to Dr. Trevor, a clinical professor, this is an extraordinary condition associated with autism. A person with serious mental disabilities may be diagnosed with Savant syndrome, as all ASDs have some island of genius. So now that we've covered the forms, I'll go over the 3 symptoms, or the 3 core symptoms that, according to WebMD, a medical reference from HealthWise, said in 2008 should never be ignored. And they are. The first one, social interactions and relationships become a problem, which means a couple of examples would be that they can't make friends their own age and having a lack of empathy for others. Now, the second one is verbal and nonverbal communications include learning to talk. And examples of that would be in the lines of not knowing how to start a conversation and may not be able to understand implied meanings once they are involved in a conversation. Then the third one is lack of interest in playing with the entire toy, which is that younger children may prefer to play with just the tire or the wheel of the toy versus the whole toy. And one of the other symptoms would be that they have to be on really strict routines, as simple as going to store or going to school or to the doctor. They have to go the same route every time, and if you try to go around for detours or whatever, then that really will stress them out. Now, the Mayo Clinic, a foundation for medical evaluation and research, stated in 2008 that there are interventions available to help children learn to function in his or her own way. Now, one is behavior and communication therapies, which will help the children improve social skills and may even be able to teach them new skills. And then another is for children to be involved in structured education with a team of specialists in a variety of activities. And then, which they usually would get done at the public school systems. Now, one more intervention that may help is medication. And certain medication may help to relieve or control some of the anxiety or behavior problems. And medication will not remove the symptoms, but they can help with them. Now, since 3 to 6 children out of every 1,000 are born with some form of ASD, knowledge of autistic symptoms and the forms are vital to accelerate placement in specific need therapies and intervention programs. All research shows diagnosing autism before age 3 gives children the needed advantage before the school years, as most autistic children are now educated in the public systems. Any questions?
Are there any other symptoms to watch for?
There's a lot. There's many. The couple of them would be babbling or not being able to babble by the age 1 or pointing to an object. But if you suspect that your child may have autism, the best thing for you to do would be to talk to your doctor, and he has a list of what they call red flags that he can give you and that you and him can go over, or her can go over. Anything else?
Is autism hereditary?
Although they are considering that it might be hereditary, they're not sure, and there's just a lot more testing that needs to be done to determine whether that plays a factor. Anything else? Okay, thank you.